Hi there. Last year, I wrote an article titled Memento Mori in Medicine and Why Every Clinician Should Practice Death Awareness. And I wanted to share a few points. I will be looking away from the camera when I'm reading, obviously. From the very beginning in medicine, in medical training, we are told that death is to be treated like the enemy, that we are to resist death at all costs, and that we are to focus on prolonging life no matter what. At least that's how it was when I was training 20 some years, probably 25 years ago. And some things have changed recently in the medical education. So there has been more emphasis on trying to create part of the curriculum to reflect death literacy and to train clinicians to be able to have conversations with dying patients and their families. And how do I know that? Because I was recently back in school in 2021 when I was doing my fellowship in hospice. And I actually participated in skits that our hospice and palliative department held for other departments of the hospital so that we can reenact or enact situations that portrayed patient-physician interactions during the time of somebody's end of life, basically, so that we can point out to other departments in the hospital how one should speak to a family member or a patient who's dying, basically. That was just an example, but there's other courses now embedded in the curriculum. So that is a positive sign, a positive move towards the right direction. This is vastly important because we have become so skilled at reading numbers and managing symptoms, but cannot sit with somebody's sorrow. I myself, when I was a fellow in 2021 to 2022, I was in a hospital doing hospital work, and I would run into clinicians who would burst into tears, who could not manage the load and the trauma that they were enduring every day. And I remember a specific case where I was with my preceptor, an oncology physician, who was crying basically because she had to go and tell a patient of hers that she was going to die from metastatic cancer. And she didn't want to do that, and she didn't know how to do that. Well, that was concerning that she wasn't able to carry out. Well, the two levels that concerned me was, number one, that she didn't feel comfortable going in there and sharing those news. Yes, that is a very tough part of our job as physicians. Absolutely. I'm not minimizing that at all. And the second layer of that was that she was in tears, sobbing to me that she has no outlet and she has no one to talk to about these difficult things that have to do with her specialty. I had run death cafes in my hospital at the time to help educate and bring awareness to death and dying to the entire hospital, not just hospice and palliative department, because we do that very well. But it is the other departments in the hospital, the people that do not work in death and dying on a daily basis, that are having a little bit more of a harder time accessing that space where they need to look inside themselves really and be comfortable with death and dying in order to be able to sit down with somebody who is dying or their families and be able to but communicate with them openly and honestly. And a lot of what I talk about in my death cafes has to do with the fact that people are not comfortable with death and dying because we as a society are death phobic and death denying to a large degree. So it is no surprise that physicians grow up, or nurses, and go through the medical training, which also doesn't support a lot of death education, and come out not being well equipped to have these conversations with patients, because they themselves don't have a relationship with death and dying. They themselves are scared to face mortality. They are scared to look at their own fears and their own fears around mortality. So if somebody's afraid of their own death or to even think about it, how can they speak to somebody who is dying? That is very triggering for them. And so the death cafes that I do aim to, again, raise awareness to the fact that unless we as a society change and start educating our youth as parents, but also in schools, on the importance of death as a normal process, just like we focus on birth as a normal process and normalize death in general. We are not going to be able to raise adults that are comfortable. And those adults, some of them end up being clinicians. So again, it's not a surprise. It's not a surprise that today's physicians and clinicians in general have a hard time. And I'm not saying every physician, right? I'm not trying to generalize, because I've met some incredible physicians of all specialties and nurses and all kinds of clinicians that have been very adept at being with people who are dying and beautifully handle the conversation and their family and hold their families. So again, not everyone. It's just to a large degree as a society, we seem to lack that capacity. So yes, I just wanted to make that, emphasize this very important aspect of where I see needed education and further awareness to continue to be raised. Thanks for listening.